I want to start with a number almost everyone recognizes: 120/80. For decades, we've been taught to believe that 120/80 is the gold standard, the perfect score, the number that makes doctors nod with satisfaction and patients breathe a sigh of relief. Maybe you've had that moment yourself, sitting in a clinic chair, sleeve rolled up, watching the cuff tighten, then hearing, "Your pressure looks great." But here's what I've seen after years working around aging hearts and fragile circulation. For adults over 70, that same perfect number can sometimes create problems nobody warned you about. Have you ever woken up in the morning feeling strangely foggy, like your mind takes longer to turn on than it used to? Have you noticed that moment when you stand up from bed or from a chair and the room spins just for a second? Maybe your legs feel weaker than they should. Maybe you've had a fall or a close call that seemed to come out of nowhere. Most people blame age. They say, "Well, I'm getting older. That's just how it goes." But here's what most people miss. Sometimes those symptoms aren't simply aging. Sometimes they're signs that blood pressure, especially in older adults, has been pushed too low for the body that carries it. I remember one older gentleman, late 70s, who proudly told me his blood pressure was better than ever. His numbers were textbook perfect, lower than they had been in decades. His doctor had congratulated him. His family felt reassured. But he told me something else quietly, almost like an afterthought. "Doctor, every morning, I feel like my head is full of fog, and sometimes when I stand up, I feel like I might fall." That detail mattered more than the number on the monitor. Because in an older body, blood pressure is not just about preventing strokes years from now. It's about keeping enough blood flowing to the brain right now, every time you stand, walk, or turn. So here's the real question we need to ask, one that almost nobody talks about openly. What blood pressure actually protects an aging body? Not just on paper, but in real life. Not the number that looks perfect on a chart, not the number that works for a 45-year-old executive, but the number that keeps a 75 or 85-year-old steady on their feet, clear in their thinking, and safe from dangerous falls. This conversation is not about guessing. It's not about chasing the lowest number possible. It's about understanding a truth medicine is finally recognizing. As the body ages, the rules change. And in the next part, I want to show you exactly how the research began to challenge the idea that lower is always better. Now let's talk about where that famous number, 120/80, really came from. Because here's what most people were never told. The blood pressure targets many of us grew up hearing about were built largely from studies involving younger and middle-aged adults, people in their 40s and 50s whose arteries were still relatively flexible, whose balance systems were sharp, and whose bodies recovered quickly from small shifts in circulation. In those groups, lowering blood pressure aggressively made sense. It helped reduce long-term risks like stroke, heart attack, and kidney damage over many years. But here's where the story becomes more complicated. When researchers began following already older adults, people in their 70s, 80s, and beyond, they started noticing something that didn't fit the old assumptions. Some seniors whose blood pressure was pushed very low, especially systolic pressure, the top number, began experiencing more falls, more fractures, and more sudden weakness than expected. Think about that for a moment. The number on the monitor looked better, but life outside the clinic was becoming more dangerous. I remember reviewing the case of one woman in her early 80s. Her readings were impressive, lower than they had been in years. Her chart looked perfect. Anyone glancing at those numbers would have thought she was doing wonderfully. But her daughter told a different story. "She's fallen twice this year," she said, "and lately she holds on to the wall when she walks to the bathroom." That's the trade-off most people don't realize exists. A lower number is not automatically a safer life. Because blood pressure is not just a statistic. It's the force that pushes blood uphill to your brain through narrowing vessels against gravity every time you stand. If that force drops too low in an aging body, the brain may not get what it needs, especially during movement. And when the brain doesn't get enough blood, even for a few seconds, balance suffers. Reaction time slows, vision dims, muscles hesitate, and that's when falls happen. Here's the paradox that surprises many families. Sometimes the better reading on paper leads to worse function in daily life, more dizziness, more fatigue, more hesitation when walking, more fear of falling, and fear itself changes behavior. People move less, walk less, trust their bodies less. Over time, that loss of confidence can quietly steal independence. This is why the goal of blood pressure care in older adults is not simply about preventing a stroke 10 years from now, though that still matters. It's also about protecting something far more immediate: stability today, clarity today, independence today. Because what good is a perfect number if it leaves you too weak to stand confidently, too foggy to think clearly, or too unstable to walk across your own living room? In the next part, I want to show you why the aging body reacts differently, and why the same pressure that works beautifully in a younger person can become risky in someone decades older. So why does this happen? Why can one blood pressure number feel perfectly fine in a 50-year-old, but leave an 80-year-old dizzy, foggy, and unsteady? I want to make this simple, because once you see the mechanism, the whole picture changes. The first reason is this: your arteries change with age. When we're younger, arteries are more elastic. They expand and absorb pressure with each heartbeat. They have some give to them, but over time, those blood vessels begin to stiffen. I often explain it like this. Imagine a garden hose that has been left out in the sun for 15 years. When it was new, it was soft, flexible, easy to bend. But after years of heat and wear, it becomes harder, more rigid, less forgiving. That is what aging can do to arteries. And when the body's pipes become stiffer, the heart has to push harder to move blood forward. That is one reason systolic blood pressure, the top number, often rises naturally with age. It is not always a sign that the body is failing. Sometimes it is the body adapting to older, less flexible circulation. Now here's where people get confused. They see that higher top number and think, we need to push it down as low as possible. But if you force pressure too low in a system built around stiffer vessels, you may not be improving circulation, you may be weakening it. The second reason involves something most people have never heard of: baroreceptors. These are pressure sensors built into your blood vessels, especially in areas like the neck and chest. Their job is to detect sudden changes in blood pressure and help the body adjust quickly. When a younger person stands up, these sensors react almost instantly. They tell the heart to speed up slightly. They tell blood vessels to tighten a bit, and that helps keep blood moving to the brain. But in older adults, those sensors often become slower and less sharp. So what happens? You stand up. Gravity pulls blood downward. For a brief moment, the brain gets less blood. In a younger body, the system corrects quickly. In an older body, the correction may lag. Now add blood pressure medication on top of that, especially if the dose is a little too strong or the target is a little too low. That brief dip becomes bigger, and that is when an older adult may feel lightheaded, weak, or suddenly off balance. Sometimes it lasts only seconds, but seconds are enough to cause a fall. I've seen that moment change a person's life. One misstep in the bathroom, one hand missing the countertop, one fractured hip, and suddenly independence is gone. The third reason is quieter, but just as important. The body processes medication differently with age. The liver and kidneys are the body's chemical filters. They help break down and clear medications. But as we get older, those organs often work more slowly. That means a blood pressure pill that is perfectly reasonable for a 52-year-old may last longer and hit harder in an 82-year-old. Same pill, same dose. Completely different effect. And this is what I want you to remember. The older body is not broken. It is different. The arteries are stiffer. The pressure sensors are slower. The drug processing system is less forgiving. So when you hear that one universal number should fit everyone, be careful. Because in older adults, blood pressure care is not just about lowering pressure. It is about preserving circulation, balance, and brain function in a body that now plays by different rules. And in the next part, I'm going to show you the blood pressure ranges that often make far more sense based on age, health, and frailty. So let's get practical. If 120/80 is not the universal answer for every older adult, then what is? The most honest answer is this: there is no single magic number. There is a personalized safe range, and that idea matters more than most people realize. Because the right blood pressure for a healthy, active 68-year-old who still travels, exercises, and moves confidently through the day may not be the right blood pressure for an 88-year-old who feels unsteady, takes multiple medications, and has already had 1 or 2 falls. Those are not the same bodies. They do not have the same reserves, and they should not always be treated as if they do. Here is the simple framework I want you to remember. For adults roughly 65 to 74 who are healthy, active, and functioning well, a systolic pressure, the top number in the range of about 125 to 135, often makes sense. That range is low enough to offer meaningful cardiovascular protection, but not so low that it automatically pushes the body into dangerous undercirculation. For adults in that same general age band who have multiple medical conditions, reduced stamina, or more medication sensitivity, a more realistic range may be around 130 to 140. Now, as we move into the 75 to 84 range, things often shift again. At that stage, a systolic pressure around 135 to 145 may be far more appropriate for many people, especially if there is stiffness in the arteries, balance concerns, or symptoms when standing. And for adults 85 and older, or those who are clearly frail, losing weight, walking more slowly, or at high risk for falling, a systolic pressure around 140 to 150 may sometimes be the safer zone. I want to be very clear here. This is not about giving up or accepting poor health. It is about respecting physiology. A strong, active person in their late 60s may tolerate a lower target because their circulation, balance, and recovery systems are still more resilient. But a frail adult in their late 80s may pay a heavy price for that same number. What looks good on paper can feel awful in real life. And that brings us to an important point. In older adults, the systolic pressure often matters most. Why? Because as arteries stiffen with age, the top number tends to rise more than the bottom number. That top number reflects the force needed to push blood through older, less flexible vessels. So when we talk about blood pressure in seniors, the top number often tells the more important part of the story. But do not ignore the bottom number, because diastolic pressure, the lower number, can become dangerous when it drops too low. Have you noticed how many people focus only on the top number and barely look at the bottom one? Here's what they miss. The heart itself gets much of its blood supply during the resting phase between beats, and that depends heavily on diastolic pressure. If that number stays too low, especially drifting below the mid-60s, the heart muscle may not be getting the support it needs. So the safest blood pressure is not simply the lowest one. It is the one that protects the brain from fog and falls, the heart from strain and underfilling, and the body from instability all at the same time. And in the next part, I want to show you the warning signs that many families dismiss as just aging, when in fact they may be clues that blood pressure has been pushed too low. Now let's talk about the clues the body gives before something serious happens. Because in older adults, blood pressure that is too low does not always announce itself with drama. Sometimes it whispers. It shows up as dizziness when standing, a strange heaviness in the morning, a mind that feels slow to clear, what many people call brain fog, cold hands and cold feet even in a warm room, a moment of near fainting that passes so quickly the person shrugs it off and says, "I'm fine now." Have you noticed how often families explain these things away? She's just getting older. He's slowing down, that's all. She's tired because of age. He gets a little dizzy sometimes, but that happens. Sometimes that is true. But sometimes those are not vague signs of aging at all. Sometimes they are circulation clues, signals that the pressure pushing blood to the brain and body may be dropping too low, especially when standing, walking, or getting out of bed. I remember an older patient whose family was proud of his blood pressure readings. Every appointment sounded like good news. Excellent control, they were told. Beautiful numbers. But his wife kept noticing small things. He was slower in the mornings. He seemed mentally cloudy before breakfast. He reached for furniture when he stood up. Once, he paused in the hallway and looked confused for a few seconds. Nothing dramatic. Nothing that sounded like an emergency. But that is exactly why it was dangerous. Because these symptoms do not just make a person uncomfortable. They quietly raise fall risk. A brain that is briefly undersupplied does not judge space as well. A body that feels weak does not react as fast. A person who gets lightheaded may misjudge one stare, one rug, one turn in the bathroom, and in older adults, one fall can change everything. This is the emotional truth I want families to hear clearly. Many older adults are not failing because they are aging. They may be overcorrected. Their pressure may look perfect on a screen while their body is struggling in real life. So do not ignore the whispers. Do not dismiss every symptom as just age. Because in the next part, I'm going to show you a simple 3-minute home test that can reveal whether blood pressure is dropping into a danger zone when an older adult changes position. Now I want to give you something practical, something simple, safe, and incredibly revealing. It's called an orthostatic blood pressure test. That sounds technical, but the idea is straightforward. It simply means checking whether your blood pressure drops too much when you change position, especially when you move from lying down to standing. Why does this matter? Because many of the most dangerous moments, falls in the bathroom, dizziness near the bed, sudden weakness when getting up, happen during those exact transitions. And the body doesn't always warn you ahead of time. So here's a simple version of the 3-minute test that many clinicians use as a starting point. Step 1. Lie down flat on a bed or couch. Stay there quietly for about 5 minutes. Let your body fully relax. No talking, no scrolling on your phone, no distractions. Then measure your blood pressure while still lying down. Write that number down, not in your memory, not in your head. Write it down. Because patterns matter more than single readings. Step 2. Stand up carefully, but normally. Do not rush. Once you are standing, measure your blood pressure again within the first minute. This is the moment when gravity pulls blood downward and the body has to respond quickly. Step 3. Compare the numbers. Here's what matters. If the top number, your systolic pressure, drops by more than about 20 points, that's a warning sign. If the bottom number, your diastolic pressure, drops by more than about 10 points, that also deserves attention. Those are what clinicians often call red flag changes. But numbers are not the only thing that matters. Symptoms matter just as much. If during this test you feel dizzy, if your vision dims, if your head feels light or your balance shifts, if your legs feel suddenly weak, those sensations are just as important as the readings on the monitor. I've seen patients with acceptable numbers who still described a wave of lightheadedness when standing. That detail alone told us something important was happening. Now let me be very clear. This test is not meant to diagnose yourself. It is not a replacement for medical evaluation. It is a monitoring tool, a way to gather useful information that helps your doctor see patterns that might otherwise be missed. And one of the most powerful things you can do is keep a simple written log. Date, time, lying number, standing number, symptoms, if any. Bring that record to your next appointment. Because when you walk into a clinic with numbers, patterns, and observations, you're not guessing anymore. You're giving your doctor the kind of information that leads to safer, smarter decisions. And in the next part, we're going to talk about exactly how to have that conversation with your doctor in a way that protects your independence, not just your numbers. Now, this is the part I care about most, because this is where fear turns into action. First, let me say this as clearly as I can. Do not stop, reduce, skip, or retime your blood pressure medication on your own. Not because your symptoms are imaginary, not because your concerns are unimportant, but because changing medication without guidance can create a different kind of danger, rebound pressure, stroke risk, or sudden instability. The smarter move is this. Bring evidence. Bring your home blood pressure readings. Bring the results of your standing test. Bring a short list of symptoms, dizziness, morning fog, weakness, cold hands, near fainting, and bring timing patterns too. Does it happen most in the morning? After breakfast? After taking your pills? When getting out of bed? When standing from the couch? Those details matter, because a single clinic reading is only a snapshot, but your real life tells the full story. And here's the one question I want every older adult, or every adult caring for an older parent, to ask. For my age and health condition, what blood pressure target is safest for me? Not what's normal for everybody, not how low can we get it, but what is safest for me. I remember one woman in her 80s whose family kept hearing that her numbers looked excellent, but she was tired, unsteady, and mentally cloudy in the mornings. Instead of accepting that as just aging, they brought in a written log, lying readings, standing readings, symptoms, and medication timing. That changed everything. The conversation became more precise. Her care was adjusted. And what improved first was not the machine reading. It was her life. She felt steadier, clearer, more like herself. That is the definition of success I want you to remember. Success is not the lowest number on the screen. It is the blood pressure that protects your brain, your balance, your heart, and your ability to live independently. And in the final part, I'm going to bring this all together, so you leave with one clear message about what truly matters most when it comes to blood pressure after 70. So let me leave you with the one truth I wish more older adults heard sooner. The right blood pressure for a senior is not always the lowest one. I've seen too many people chase a beautiful number on a machine while their real life was quietly getting worse. They were more tired, more foggy, more unsteady, more afraid of falling. And yet everyone kept saying, "But your pressure looks perfect." That is the trap. Because after 70, the goal is not to win a contest for the lowest reading. The goal is to stay sharp enough to think clearly, steady enough to walk safely, strong enough to live independently, and protected enough to avoid the fall that changes everything. That is what truly matters. Not just years added to life, but life protected inside those years. So I want to ask you something, and I really hope you answer honestly. Have you ever been told your blood pressure number was perfect even while you still felt weak, dizzy, foggy, or just not like yourself? Tell me in the comments. Your experience may help someone else realize they are not imagining it. And if you have a parent, spouse, sibling, or friend over 70, please share this episode with them. One simple conversation about blood pressure could prevent a dangerous fall, a frightening fainting spell, or months of unnecessary decline. And now, the most important medical reminder. This episode is for education only. It is not personal medical advice. Do not stop, reduce, skip, or change the timing of your blood pressure medication without speaking to your doctor. Never make medication decisions based only on a video or podcast. Always consult your own physician or healthcare professional for advice based on your age, symptoms, medications, and overall health. I've spent enough years around vulnerable hearts to know this. Sometimes the safest care is not more aggressive care. Sometimes the wisest target is the one that helps an older body stay clear, balanced, and upright. Protect the brain, protect the heart, protect the feet on the floor, and above all, protect the life those numbers are supposed to serve.